Second type of biopsy we do that's fairly common is a punch biopsy. We use a small instrument to collect a piece of tissue near the sore, and then we'll send that in. So that was an example of the punch biopsy. That small tool is used to take a small piece of tissue under local anesthesia and provide that tissue to the laboratory excuse me, to view under a microscope. The last type of biopsy we like to do besides the brush biopsy and the punch biopsy is a surgical biopsy. I don't have any photographs of the surgical biopsy, but essentially it's basically an expanded type of punch biopsy where we use a small surgical blade to take a piece of healthy tissue next to the potentially cancerous tissue, and we can send that in to be looked at under a microscope. What the dentist is usually looking for is an ulcer, some type of a lump. There could be red changes and white changes. Most often we see a combination of red and white, usually a red center and a white border. The difficult thing is that a lot of cancer looks like normal tissue or looks like a normal sore. So you can have a canker sore or a cold sore on your lip or an area that you may be damaged by biting yourself, and it can appear to be a wound and it's actually cancer, or vice versa. Only a biopsy can determine whether the tissue is normal, abnormal, or cancerous. The one cancer that is most common and most dangerous in the mouth is squamous cell carcinoma. 90% of mouth cancer is this type of cancer. I'm going to show you a number of different views of squamous cell carcinoma, and we'll go through those photographs so you can have an idea of what they can present like. So as you can see, many of those cancers, while they looked angry, could be mistaken for normal trauma to the cheek or to the lip or something like a cold sore. So don't ignore the sores in your mouth. Make sure you see your dentist annually and see your hygienist every 6 months because they do screenings also. If you're getting a good exam, if you're not getting a good exam, then see another dentist. If you feel like you're getting good oral exams, stay with the dentist you have, and just continue to avoid products like tobacco and alcohol. Thank you very much for listening to this presentation.
Yay.